Hi, my name is Dr. Mike Smith. I'm the Senior Health Scientist here at Life Extension. Today I want to talk about how inflammation can affect your cardiovascular system. Now, you can't live without inflammation. It's how your body responds to a problem, whether that be a broken bone, an infection, or even a cancer. Now, inflammation is designed to be an acute process. Basically, you get the immune cells and repair cells in quickly, and you get them out fast. If those cells, they're powerful cells, if they hang around that area too long, they will begin to damage healthy cells and tissue. As a matter of fact, chronic inflammation is simply acute inflammation that has not resolved properly. And chronic inflammation is the common denominator of all age-related disease. Now, your entire body is susceptible to inflammation, but that's especially true for the heart and the blood vessels. The lining on the inside of the blood vessels is called the endothelium, or the endothelial cells, and they are very susceptible to inflammatory damage. As a matter of fact, when that lining becomes damaged, that's when we start to see problems with arterial stiffness, blood pressure issues, and even advanced atherosclerosis, or arterial plaques. Now, there's a marker of inflammation called C-reactive protein, and studies clearly show that when CRP, C-reactive protein, is high, that is an indication that there's a lot of inflammation and you're going to be at greater risk for heart disease. Two independent studies published in the New England Journal of Medicine validate C-reactive protein. They both showed that low CRP is associated with low risk of heart disease, and they also showed that when you lower CRP with nutrients or even medications, that there's a lower risk of having an acute heart attack. Now, the first thing we want to do is we really have to watch what we eat. The typical American diet, which is a lot of animal protein and dairy, is loaded with a compound called arachidonic acid. This is the body's precursor to all of the inflammatory proteins that drive inflammation. So we got to really watch the animal protein in the dairy. We also know that fat, saturated fat specifically, and high sugar foods can raise C-reactive protein. We need to switch our diet to the whole grains, the leafy greens, the deep dark fruits and vegetables. As a matter of fact, an independent study showed that if you eat the grains, the greens, the dark fruits and vegetables, you can lower C-reactive protein by up to 39% and improve bad cholesterol. Now, we appreciate the fact that it could take some time to make better dietary choices. So I want to suggest some nutrients that can help to ease inflammation right now. The first one is called Boswellia. This is an amazing medicinal plant that produces a very bitter sap that has a compound in it called AKBA. When you ingest AKBA, it can inhibit an enzyme called 5-LOX. This is important because experts will tell you that the 5-LOX enzyme is associated with 1.5 million deaths in the United States. Why? Because it drives inflammation, and inflammation is a part of diseases like heart attacks, stroke, Alzheimer's, even cancer. So we suggest about 100 milligrams a day of Boswellia that's standardized to 20% AKBA. Now, how about the omega-3 fish oils? I bet most of you take those already. Hopefully about 2 to 4 grams a day with food to get the best absorption. The fish oils are a great way to ease inflammation throughout your body and protect your heart. Here's what you may not know. When you add olive fruit extract and sesame lignans to the fish oils, they will actually ease inflammation better than the fish oil alone. And lastly, we have one of my favorites. It's curcumin from the Indian spice turmeric. It adds a wonderful color and flavor to foods. Well, it turns out curcumin, which is a component of the spice, can actually inhibit another powerful inflammatory enzyme called NF-kappa beta. This is one of the most powerful proteins in the human body that drives inflammation. So anything we can do to ease its activity will ease inflammation throughout your body. So yes, there is a direct connection between inflammation and heart disease. So we want to do what we can to ease chronic inflammation throughout your body. Thank you for watching. My name is Dr. Mike Smith.